Drug abuse, cancer,
measles, diabetes, AIDS, cancer.
Good evening once again, folks, and again let me apologize for the late start of our program. We did experience some little technical problems. We're over them now, and we are about to start our program for this evening. Welcome to Doctrine Call for this evening. Of course, we say welcome to our viewers of GBN Television, Channel 7 and 11. Of course, you, our loyal listeners on K105 FM. With this evening with us, Dr. Sonia Nixon, and I'm always so very happy to have her. Look at that smile on her face, folks. Look at that smile. Such beautiful smile. Yeah? It makes you feel better if you're not feeling well. Doc, good evening.
If I roll my eyes one more time at you, up off. The strings are no open. Good evening to Grenada. It's really good being.
Oh yes, indeed.
This post-jam
Hedonism. Anyway, that's something for tomorrow evening to talk about. But Doc, welcome again. This evening we're talking about rheumatic fever and other rheumatic conditions. Last week we did tell our listeners that, and so we're going to get started right away. When we speak of rheumatic fever, what are we talking about?
So I don't know that I really want to jump straight to rheumatic fever, because rheumatic fever is actually preventable and treatable.
Right.
So I think we need to. Rheumatic fever basically is an inflammatory disease that includes problems with the heart.
Okay. Mm-hmm.
And the skin, etc. Okay. Mm-hmm. So I want us to go back, and we live in an era when there's a lot of knowledge that works. I still can't figure out why people don't wear masks in this time of COVID, right? But rheumatic fever is something that we hadn't seen since the coming of penicillin, because once penicillin came as an antibiotic, people no longer had a challenge.
Okay.
Go back to what causes rheumatic fever. Mm-hmm. So we can we can look at the trajectory and figure out how this happens. There is a group of bacteria called Streptococcus.
Yes.
Right? And you've heard of people loosely saying that they have strep throat. So the group A, strep, has one kind that attacks your throat. And attacks from 5 to 15 mostly. It doesn't mean that adults can't get it, and it doesn't mean that children can't get it. And there are people who have more risk for getting strep throat. Guess what? We probably all buck it up at some time, come in touch with it. But if you have a good nutritional state and the immune system is good, you probably won't get it, like other things, right? Other infectious diseases, because it's caused by bacteria, remember, right? So if you have a good immune system and you live in a relatively comfortable place, we know that the social determinants of health would affect us. Third world, people living in poverty, and especially where you have overpopulation. So sometimes you find that people who are in barracks, like soldiers, or who go on to camp, or children who are very close to each other, or houses where you have overcrowding, those are people who are little at risk. They also think that some families are a little more prone, because remember I said that we probably can come in contact with the bacteria and don't get infected, right?
Right. Mm-hmm.
But there's some people who, for some genetic reason, their bodies will be more readily affected by this strep bacteria, right? Those are the people at risk. There's one other group. But we know that those are the people at risk. The age group, 5 to 15 years old, right? The sore throat, a strep throat is not an ordinary sore throat.
Okay.
And I'm sure, as we've spoken about antibiotic abuse and resistance to medication resistance and all the rest of it, we've talked about not treating sore throats with antibiotics. Because most sore throats we get are very self-limiting. They're caused by a virus. You know, children when cough and cold season, they got a sore throat, they look a little red. You got warm salt water, you give them something for the pain and they're good, right? And they probably can even eat. Not so with strep throat. Real strep throat, not the thing, oh, I'm a strep throat. No. Real strep throat, don't even talk because it's so painful, right? So a strep throat takes over your well-being a little more. So it's very ill. He don't eat because he can't swallow because his throat is so red and swollen.
Inflamed.
And there's a white matting on it, okay? There's that plaque on it. Fever, headache, really feeling very, very ill, okay? And the difficulty to swallow, like I said, right? Rash on your skin, and they might have the glands in the neck will be very tender, very swollen, right? That is not ordinary sore throat. That's strep. It's ill. The tonsils, you look at them and they're red and they're angry. Okay, they're not you know, oh, your throat a little red. No, that is going to pop. It's really red and ugly. Child will have headache, nausea, vomiting. So you have basically a child who's sick, whose temperature will be over 38, over 101, right? That and up, right? And will be sick for days, right? Sometimes they have a thick or even a bloody nasal, you know, secretion from their nose. So that's a very ill child, okay? And those are the children that recur. Well, there are other children who need antibiotics, but yes, it is important that strep is treated not only until symptoms subside. You know, we do it. I feel better, man, I'm done.
Yeah, you're done.
No. I feel, no, man, I'm good, all right. No. You really need to obliterate that bacteria. If not, whatever bacteria remains in your system, because guess what? Because you've given it antibiotics, don't mean that it's going to lie down and dead, okay? It's there, it's going to try and fight and try and find ways to hide around. If you don't treat as should, you'd have all these residual bacteria around that will attack other tissues, okay? They'll attack tissues like the heart tissue and the joints and the skin, right? And that is where you will develop, that's where the rheumatic
comes from. Okay.
So like I said, and the worst thing is that you can also have challenges with the brain. So as things gets worse, you get worse disease, worse clinical pictures. Do we have a need? No, because the antibiotics that are still present work. I saw the doctor probably a year or so and was asking about rheumatic fever, and he actually said that they were seeing more people there because rheumatic fever has such severe complications, and among those complications is severe heart disease. So you'd have people who have heart failure at 25 years, at 22 years old, at 18 years old, because their heart has been so attacked by this bacteria, being treated or prevented, right? And they have not. So I have a girl I know who was one of my patients who died by the time she was 25 because her heart just gave away. Okay, she just couldn't manage. But we have antibiotics, and there's a way to care for this. So once someone has had a strep infection, you really want to follow them up properly, right? If you get to the point where you're diagnosed with rheumatic fever, which is the other step, then you want to make sure that you do not transition to those complicated situations where your brain and your heart and all of that are affected.
Right. Now, a question. Now, what are the possibilities of someone contracting the strep bacteria? However, maybe not in a large way, I should say, and I hope I'm using the right terms here and I'm making sense.
You don't have a very visible infection, like a florid infection.
Right. Okay. But for some reason, so you don't have that terrible throat. You don't have a strep throat, But the bacteria, what are the possibilities of the bacteria attacking other tissues, as you mentioned, like the heart, the brain, the joints? So in other words, you don't get the symptoms of the throat, but it attacks other bodily tissues.
3% of people who get rheumatic fever, will have severe problems. Who get strep throat at all will develop rheumatic fever, right? And like you say, there are people who are not going to manifest, but you can, if a child comes, you have to have a high index of suspicion. Remember, there are conditions under which a child who's under 15, 5 to 15, you might have had a mild sore throat, but there are other symptoms because rheumatic fever has its own symptomatology. So there's that. But then there's rheumatic fever, right? Which is a strong inflammatory disease. And like we said, it's caused because somebody's had a strep infection. Or they might have scarlet fever, which is caused by the same bacteria.
Right? Okay.
Which is caused by the same bacteria that you haven't treated. There are symptoms that are associated with having rheumatic fever. It's the most sinister thing we do at this time, okay? Because yes, they have generalized symptoms. They really feel very ill and very tired. You now have the apparition of some painless nodule, little peas under the skin, right? So they show up. They will show under the child's or the individual's skin, right? They may have chest pains, right? They'll have severe fever, palpitations, heart fluttering, right? Fatigue, feeling very tired, feeling very weak, lethargic, stomach ache, discomfort, painful, large, swollen joints. And that's one of the things that shows up, the joints. So it's your elbow, your wrist, your knee, and your ankle, right? One at a time. It's called migratory arthritis. One, the next one, the next one, the next one. So one subside, the next one comes, right? Because the bacteria, that's how he works. He goes around, right? Right, but it attacks a single joint at a time, right? And then there's shortness of breath and fever. And some people even have seizures if they have brain involvement, so they can have like a seizure fit. Right? Those are the things that happen when people have rheumatic fever. So you've got to have, what you have to have is an index of suspicion to believe what's going on here. What could this child have? A child would come, like you say, maybe we missed a strep throat. Let's say we missed a strep throat. 2 weeks later, the child comes and he's sick. Or you might have a little cold or seems to have a little throat. He doesn't make a fuss about it. But 2 weeks later, here's a child sick again. You have to look for it. And there are tests that you can do, like, blood tests. There's a antibody titer that you can find so that you look for antibodies to strep in the child's blood. And you treat. And you treat aggressively. And you treat over a long period.
Right. What about this symptom of an outburst of crying and inappropriate laughter? Sometimes I just laugh out. I don't know what.
Your problem is that you're too old to have rheumatic fever. No, but remember you have brain involvement, so you can have all of those things.
All of those things, yeah.
So and remember. We will talk about the most symptoms that are most likely to appear, but there are always somebody, one or two people might have that is not defined or characteristic of the disease. But yes, the laughter and the behavior is part of the whole brain involvement.
All right, lovely. What about things like vomiting and stuff like that? Do you get it as well?
Remember, right? You have inflammation of lots of the tissues. So your stomach can be involved. Remember I spoke about pain. Right? So the child can also vomit it if the stomach is inflamed and that indigestive symptom. So that's the problem. Right.
I want to just swing in a bit. We're in COVID season. Strep throat, COVID-19.
So if you have COVID-19, if you already have it, right? Your immune system is not doing very well.
Right.
Right? So therefore, people who have COVID-19 really don't want nobody who have anything else around them, especially something that could be so debilitating and so penetrating into one's whole physical being. You really don't want to. Especially when it comes to rheumatic fever, you want people to if you have had rheumatic fever or you have a strep, you kind of need to keep a child. Well, the child needs to be kept by himself, right? Isolate him a little. Don't share utensils. Cover your cough. Wash your hands. Just the same isolation, the same basic hygiene for all other infectious diseases, right? But definitely, sometimes we live in a household and we forget that we really shouldn't share utensils until somebody's much better. But certainly, if you have COVID-19 or you have another debilitating illness, you really should stay from somebody who has a strep throat.
Right. Let's talk about the well, we mentioned about the symptoms. I want us to go into some more depth with the treatment, because so it affects your heart, your brain functions, and all of that. Getting close to your heart is serious business.
Yeah.
So can it result in what? In heart failure or heart attack? What?
There's several things that can happen to your heart, right? And sadly, that's one of the most common complications, right? The heart problems. That is if you don't treat the rheumatic fever. Remember, you probably can prevent it by treating the strep infection. Rheumatic fever happens when you don't treat the strep infection properly. But you still can treat rheumatic fever. And there is a program where people are given penicillin or drugs that have similar actions, because some of us are in fact allergic to penicillin. We can have severe outcomes, right, from getting penicillin injection. Once a child has been diagnosed or a person has been diagnosed with rheumatic fever, children should actually get penicillin injections monthly until they're 21, or for 5 consecutive years. And then you check and see how they're doing, and you can stop. But you need to follow them up. So some people require treatment until they're 21 years old. Mm-hmm. That's what is going to prevent. What's going to happen to your heart? Well, the heart valves, those little things that open and close to let blood flow or not flow to your heart. You don't want flow back, right? And everybody knows what a valve is, okay?
Yes.
For the most part. So a valve kind of controls how fluids flow, right? For the most part, right? This mitral valve can actually get stenosed, meaning that it can get tight, it can close down.
Mm-hmm, mm-hmm.
Close down, blood can't go through it. It's like trying to blow through a pipe that's closed. We know.
Yeah.
We've seen pipes get closed with get clogged with whatever, with rust or fat in the case of the sink, oil, and the kitchen sink. You cut it and you see the valve gets smaller, so the heart is trying to pump, and
nothing's happening. Mm-hmm.
So the heart can make your heart fail, go into heart failure. So that's another one.
Mm-hmm.
Then there's aortic valve regurgitation. So instead of the blood flowing through, the valve is so weak that you pump from the oxygenated blood to pump out, but the valve is so weak that the blood flows back. Do you understand? It's supposed to close back once it pumps out, right? But it's weak.
So okay.
So you don't get the amount of blood you have to get back.
So the blood goes in the wrong direction.
No, it just doesn't go in the right direction.
all right, fair enough. What about what? Yeah.
Some of it flow. It doesn't flow because if I do that, right?
Mm-hmm.
The valve closes, but if the valve is weak, when the thing pumps, the muscle and the heart muscle pumps, the weak valve is so weak it can't stop it from flowing back.
Oh.
So that's why go in the wrong direction. It just says all of it doesn't go in the right direction, and some just flows back.
Right. What about damage to heart muscles?
So, and that is most from the inflammation itself attacking the muscles. So, not does it have the valves, and those valves sometimes what you have is like vegetation, things like. I want to use a grenade like lally.
No. Yeah, sure. No, I mean, of course, we don't understand that. Yes.
Lally and stuff growing on it, like where we have moss growing on the ground.
Yeah.
So, vegetations on those valves that make them not be able to function well. Okay, and you get very sick. Okay, that is in people who don't get continued treatment. You can become very ill, and sometimes those little things can break off. Little pieces can break off and with your brain and stuff and cause death. All right. So you can get that valve apart from it already having vegetations that making it weak or the bacteria in it directly. You can actually have those vegetations becoming infected and you become very ill. So the child might come with a fever and pain in his chest and shortness of breath and coughing or whatever, right? Because there's a backflow one, but because he has an infection, and usually that calls for hospitalization. Yeah? So apart from that, like I said, you have damage to the heart itself. Right? So you can attack the valves, but you can attack the heart as an entity and weaken it so it can't pump, and people eventually fall into the next thing. They get into heart failure, right? You need X amount of blood to flow through if you're walking or if you're sitting down. But the muscle is so weak. Like when you blow a balloon, and you get a balloon at Christmas when you're a child, and you get a balloon and you blow it up, and the ball is nice and turgid and it can do anything and can squeak, right? And then after a while, everything just gets flaccid and soft.
Yes.
So the muscle gets really weak and soft and can't pump anymore. You want to have something that has the elasticity and all that power in the muscle, and that goes away. And that's when you fall into heart failure. And then, of course, sometimes the upper chambers of the heart, the atrium, the muscle, because it's attacked, can't. Remember, it's electricity, right? That flows through your heart. That makes the heart pump, makes it up the top part pump, and then the other part, the top part and the bottom part. So the atria will constrict and pump the blood out, and then the ventricles will pump. But when you have atrial fibrillation, that thing is irregular.
Yeah, so it's all over the place. Yeah.
And really make you feel sick.
Right.
And you're tired and all the rest of it.
Right. Before we go to the break, so a patient has that condition, but it didn't get to the point of, let's say, heart failure. But because of the nature of it, because of the seriousness of the condition, can it leave, let's say, the patient in a condition where they are not normal as they used to be? In other words, it leaves its mark on you.
It leaves its mark on you. It does, because remember, people can also have strokes. So it has very young people. Remember, we're looking at a young population. If you're going to get rheumatic fever between 2 and 15, if you're not treated, by the time you're 20 or earlier than that, you can have serious problems. Not being able to, you're tired all the time. Think of a child who's tired every day, who needs to study, who wants to play, who wants to go to the movie with their friends, who want to walk up and down, but they're just too tired to do this. So there's this permanent incapacitation. You just really can't do the things, and because it's your heart, some people need a whole new heart. Some people might need their valves repaired, But in today's world, we really shouldn't have this problem. In today's world, we have medications and we have access to care. And mothers need to understand. No, mothers, all caregivers for children, need to say, my 5-year-old, I need to look out. Why is he having this? Or he went to camp last week. Oh, they had. Well, we shouldn't. Nobody should have strep throat now because we're supposed to be doing physical separation,
physical distancing.
But we still need to remind people every day that they have to consider what the possibilities are. Why is it that one thing may be happening in their children's lives or in anybody in their family's life?
Okay, so that we're gonna go to a break. When we come back, we're gonna chat some more about this, and then we're gonna engage our listeners. If they have any questions or comments, we'll invite them. So stay with us, folks. We'll be back with you in just a moment.
and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
GBN Television News at 7, a pulse on all things Grenadian. Look out for our new features through expanded synergies with our media partners in Barbados, St. Lucia, Jamaica, Trinidad, and beyond. Capturing the latest in news, sports, weather, and entertainment. Credible, informative. Thank you for making us number one. News at 7, live, Monday to Friday on GBN Television, Channel 7 and 11, K105.5 and 105.9, Hot 98.5 and 98.7, GBN Television Facebook page and YouTube channel, and www.gbn.gd. GBN, with you anywhere and everywhere.
Let's Cook Grenada, a practical culinary guide to local cuisine. Learn new ways to prepare your favorite foods or try different menus from various locations across the island. Let's Cook, Tuesdays at 8 p.m. on GBN Television, Channel 7 and 11, GBN's Facebook page, and GBN's YouTube channel. If you miss it, catch the repeat Thursdays at 10 a.m. and Sundays at 3:30 p.m.
The Grenada Broadcasting Network is making a platform available for the children of Grenada, Carriacou, and Petite Martinique to shine. Are you between the ages of 3 and 16? Send us a video that showcases your talents. Whether it's singing, dancing, playing an instrument, reciting poetry, or a monologue, or any other talent, now is your time to shine. It's simple to enter. Just take a video of yourself performing, include your name and age in the beginning of that video, and then send that video to the email shineongbn@gmail.com. It's easy, like 1, 2, 3. The program will premiere on GBN's YouTube channel soon, so get on it. Remember, it's shineongbn@gmail.com.
Welcome back, folks. It's Dr. and Carl, and Dr. Sonia Nixon is with us. We're talking about rheumatic fever. Doc, you mentioned earlier while we were talking about some of the issues that can arise from rheumatic fever, and you did mention something called scarlet fever that can happen as a result of that. Let's talk a little bit about that. What is the scarlet fever? I mean, briefly. I'm taking you back. I'm taking you back to med school.
By that special group of strep, right? The take from the group A, right? But a lot of fever, reddening of the skin, and your hands actually peel. We haven't seen it a lot. I haven't seen scarlet. I think I've seen scarlet fever once in my career.
Okay. Mm-hmm.
It happened a whole lot. I remember we said that there's that propensity, so maybe it happens more in other groups, in other ethnic groups, whatever.
Okay. So there's, yeah. Mm-hmm.
It's there, because like I said, I've seen it once, I think, right? But you peel like a glove, but it's really different. But the pediatricians, they know it's around and they look, you know?
Okay.
So once, there must always be a high index. If you see one strep throat, you look for other things.
Okay, lovely. All right, let's just go back. I just wanted to take you back to med school a little bit. See, but
listen to me. A friend of mine told me something I did for him when I went to medical school. My friends all mad because I always remember all them things.
Yes.
I've gotten there. I have no recollection. He did me a favor, and I said, well, I don't know how I'm going to pay you. And he says, you don't. He says, you did something for me. And I said, when we first went to medical school, we first went away, right? I said, me? So these days I don't remember school.
Anyway, patients with chronic conditions, people who have, of course, hypertension, diabetes, kidney issues, and things like that. What a combination. How does it affect them? I mean, let's talk about that.
So here's what is it. People who have rheumatic fever, if we save them, will probably develop chronic disease.
Let's talk about that. That sounds interesting.
So that is what we want. We want our patients to live so they live long enough. It means, therefore, that we have to identify early real bona fide strep throat. We can take a swab and send to the lab. We also have to treat appropriately. And even if we miss, right, we have to make sure that we do prophylaxis. Every month you get your injection or you get whatever tablets you take for how long you take it until you reach that age. And we follow you up to make sure that you don't develop it. So down the road, you probably will have the opportunity, not that we're looking for that for you, but you can live long enough that you get to the age where you have chronic disease. But the bottom line, don't you think that rheumatic fever is an infectious chronic disease?
Well, I do think so. As a matter of fact, I could be wrong here. I get the feeling when you hear about this rheumatic stuff, you're talking chronic.
Yes, but again, the emphasis here is on prevention.
Right. I was going to come to that. Mm-hmm.
But to don't get to that point of chronicity because the person is sick. Because remember, chronic is related to being sick, right?
Mm-hmm.
Don't want to get to that point. So you discover your child has had strep throat. You follow that child and you give them the injection as often or whatever medication they deserve to keep them well, right? You don't want them to have that inflammation because you're trying to box up that residual bacteria that remains, okay? Make sure it doesn't get a chance to grow. Because remember when we talk about infection, you need to have a certain amount of whatever the offensive agent is, right? You have to have a certain amount to create a situation of infection and illness. So what you want to do while you're giving them whatever antibiotics is on a regular, systematic basis is to prevent those bacteria that you may have missed from growing to get to a point where the child or the individual can develop an infection again, or that the bacteria can go and destroy whatever tissue it feels like. And we would keep it in mind that the worst outcome for non-treatment could be death.
Mm-hmm.
Okay, and like I tell you, I remember this young woman in my practice, and that year I lost 2 patients who had and she had a baby, and having pregnancy is very hard on people with rheumatic heart disease, and she died. She had 2 little children, and I think she had a 3rd baby, and she died. Her heart just couldn't manage to take care of a 3rd pregnancy. Young woman, her husband was a young pastor, she died.
Mm-hmm, mm-hmm, mm-hmm.
Like 15 years ago.
Unfortunately. Mm-hmm.
Unfortunate, because if 20 years before she had been treated appropriately, she would not have developed rheumatic fever.
Mm-hmm.
Okay, and remember, like I said, in 2 weeks, if it's not treated, you can have symptoms of rheumatic fever. So what you want to do in the 2 weeks before, when the child comes to the symptoms, to make sure to treat that strep throat appropriately, and remind the parents or whoever's taking care of that child that treating them till the fever stop or till they start eat again is not the objective.
Mm-hmm.
Objective is to ensure
to get rid of the bacteria.
Right, and you see him back, and you do your swabs, and you make sure everything is in place. You do your bloods and all the rest to make sure that that child is fine.
Mm-hmm. Mm-hmm. Mm-hmm.
So, chronic disease, you asked, with it, you really don't want to have somebody who is in a state of decompensation, whose heart is already failing to develop infection, or whose heart is already failing to develop diabetes, because that puts a lot of stress on the kidneys and all the other organs that work within that ambit, right? A person who gets rheumatic fever, who has valvular infections, right? Those sort of things, the lally,
yes,
right? It's infected, piece breaks off, goes to the brain, you can die, right? You can get a heart attack. It can cause a heart attack, depends on how it gets around the system, but it can kill you by creating an embolus to your brain.
Doc, what about people who are allergic to antibiotics?
I don't know if you're allergic to everything, okay? I don't know. That'd be very, very, very few people, okay? Very, very few. Because a lot of penicillin, but they get their medications, because there are other medications, because it's not only penicillin, they get the other medications. They get other medications that have the same effect on the bacteria as penicillin.
Right, so this is here. I was wondering if there's other forms of treatment for that.
It's penicillin is easy because it's one injection and you're good for the next month. But there are other medications that you get.
Wonderful. Okay, so we will open our telephone line. The number is 435-2041. So callers or listeners, you're invited to call. If you have any questions you would like to ask Doc, you can do so now. The number again, 435-2041. Here goes our telephone, Doc. Let's see who is with us. Doctor and call, good evening.
Good evening.
Good evening. Go ahead, please.
I am calling to find out something about the rheumatic fever. Are you hearing me?
Yes, I am. Go ahead, please.
Yeah. As a child, I had rheumatic fever. They said I had rheumatic fever. But I think I was 13 years at the time because I was in scholarship class. I'm a grown old woman now. But I never had strep throat or anything like that. I just was walking and got a pain in my ankle. And then the ankle swollen. About 7 days after, the knee swollen. Then my shoulder swollen. And it was a lot of pain. And they took me to the doctor and they said it was rheumatic fever. And then I couldn't walk. I couldn't walk for almost 2 years. So I want to ask the doctor, is that rheumatic fever moving in that in that way.
Okay, thank you, caller. Thank you very much for your question.
So that's an interesting question because she said she didn't have any sore throat, right?
Yeah, I was asking about this earlier. If you could not have those symptoms but still...
You can have mild strep throat. And it depends on how you handles it. But there are ways, there are ways to find, because you will have like I said, the antibody present. She sounds like a more mature person.
Yes.
Maybe, but there's also a thing called juvenile arthritis.
Uh-huh.
Right? So you see teenagers who have arthritis and one joint swell today and the next one tomorrow and they can't walk the following day and all the rest of it. So those are the things that you have to diagnose against. You do differential diagnoses. Is it this or is it that? So maybe the doctor told her she had rheumatoid arthritis and not rheumatic fever.
So there's a difference.
It's a difference, yes. Okay, so it's not too late. If she still wants to know, she can ask her doctor to do a test and see if she has antibodies. And remember, when we talk also about a disease and its manifestation, like I told you earlier, that's what the kind of majority, but there's a bell curve. Some people at the end,
yes. Mm-hmm.
Some people might not have heart problems, and then those who have heart problems are small amount, and the people in the middle. But what I'm saying, it varies.
Right.
Mm-hmm. You would have. So I will tell the lady, she can always doctor to check and see what is going on.
All right. 435-2041. Let's go back to our telephone. Doctor and call. Good evening.
Yeah, good evening, Godfrey. You on the doctor. Good night.
Yes, good night. Go ahead.
Yeah, I want to throw something in. In all the program I was listening about doctor, you all never talk about, problem in the head, because a lot of people suffer a lot of head problem. They bounce their head, they fall down. People also have a lot of head wound. But I never hear you all have a program about, head wounds and, problem, with the head. I never heard that program before. So I want to hear something tonight about head. Because people bounce their head, the forehead swell up, all kind of thing like that.
Okay, caller, so what we're going to do, we're going to dedicate next week's program to that.
Okay, then. Thanks a lot.
All right, thank you very much.
Okay, bye.
Very good, yeah.
Thanks.
Let me indulge him a little because I live in a jurisdiction where people rode a lot of bikes. And even they tell us to wear helmets, sometimes we cheat, right? Often. And it's something that we haven't looked at because we don't have a lot. We do have head injury, but not a whole lot.
Mm-hmm.
And especially traumatic brain injury is a big thing. You've seen the discussions about the people who play American football, right? And after now they say you can't play after a certain amount of years, and you've seen people's behaviors change. So that's, I think our friend here is talking about traumatic brain injury, and that's a very good point.
Yes, indeed.
But not for tonight, and I don't know what you're doing.
Well, you would have to help me find someone, but or else you have to come back. But no, we the whole point of the program is to disseminate information to people, and they're asking for it. So if they ask for it, we have to make it available.
Not ready next week. What's your problem? You have to give the man something.
Yes, indeed. Let's go back to the telephone. Doctor and call. Good evening. Hello.
Hello?
Yes, good evening.
Hello?
Go ahead, please.
Hello?
Yes, we hear you. Yes, go ahead.
I have a problem in my...
Caller, could you turn down the volume of your radio, please? Or your TV?
Okay.
All right.
I have a problem. I have a thing called my chest day. Like the other time I want to say about me cow, and I come home, and my chest was scratching me, so I scratch it, and then after you have a kind of bump like come up and my chest here, and you have a kind of point and it swell. Well, I end up going by the doctor and show him. Doctor tell me, well, they give me an appointment to come in the hospital in Maribo. This is 1st of September. So I'm going to cut it, but I cannot concern. I don't know what this thing is. I want to know what the doctor could give me an explanation. What this thing come to me, because he just want to call it score. He just scratching me. So it's scratching me so nice, so I must scratch it. So I just scratching and he just come up like that. So I don't know what caused it and what is the problem. Okay.
Thank you, caller.
Look, gentleman sounds like he's a farmer, right?
Yes.
And he says it's on his chest, right?
Uh-huh.
So he might have just gotten an infection in a hair follicle that caused a little abscess or something there, right? That's probably, or the follicle just got infected and swelled up big. And it will itch because the skin stretch and the nerves in the bottom of the follicle they get irritated because probably the doctor thought it was something urgent. He'd have done it there and then. And maybe he could have done it there and then, but he just chose not to, right?
Right.
But you should worry, sir. You can rub it with a little bit of olive oil or something just to keep it, to soothe it and stuff. Put warm packs on it in the night or in the morning and in the night. But maybe just the follicle got infected. And maybe you should ask doctor to check and see if you're diabetic at the same time.
Right. Wonderful. Sure. 435-2041. That's the number you can call. And if you have any questions, of course, Doc will be more than happy to engage you with your questions or your contribution to the program this evening. We're talking about rheumatic fever. Doc, there are other conditions which involve... Well, let's take that call. Here's another one. Doctor and call, good evening. Seem to have lost it. 435-2041. That's the number. You can try back, caller, with your question. Right, let's try again. Doctor and call, good evening.
Yeah, good night.
Yes,
nice
go ahead. Yes, go ahead, please.
I try to find out something. When I was growing up, there was a guy who used to feel sick, and then they say he was rheumatic fever. So this guy come and have 2 children after, and them children die. So I don't know if this does spread you. Do you understand me?
Yes.
Okay,
All right, no problem. Mm-hmm.
I'm going to ask you to repeat because I didn't hear everything.
Yeah, what he said, there was this gentleman who used to always be sick. And then he came and had 2 children, and 2 children died. He said that they told him he had rheumatic fever. So he wanted to know if it can be passed on.
I don't know about being passed on. I doubt. But remember we talk about environments, eh?
Yes.
Remember we talk about environments and those social determinants, unless you change those things, you change people's education level and how they live, what they understand, how they behave generally, right? If you live in a better house, if there are less people living in the house and more space and better ventilation and clean water and electricity and road and all the things that improve people's quality of life and make and food and good food, right? Those things that put people at less risk for getting ill. Okay, I don't know why the gentleman was sick. You could have rheumatic fever. I could have rheumatic fever and my child has asthma that are totally unrelated, right? And we don't know what mommy had. Maybe the children had other things, asthma. Maybe they didn't get vaccines and they had other diseases.
Something else, yes.
Well, it's a very ample question. You can ask a lot of questions, get information. But like I said, you can have COVID and have high blood pressure.
Right.
So you can have different diseases occurring in one person. And because he had rheumatic fever doesn't mean that his children would have got it from him. I have never heard that.
Okay. Let's go back to the telephone. Mm-hmm. Dr. and call, good evening. Lost it again. 435-2041. That's the number. You can try again, caller. 435-2041. Doc, I was going to ask earlier, we hear a lot about rheumatic conditions. Not necessarily rheumatic fever, but rheumatic condition. Are they in any way associated with the strep bacteria?
No. Because rheumatic fever as is on its own, but you have other rheumatic conditions, which means inflammation and sometimes of the joints.
Okay.
Right? So you have rheumatism.
Right.
You have
inflammation. That's inflammation of the what?
Joints.
Right.
And the soft tissue around the joints. Right? So that's why you have a rheumatologist who's a specialist who deals in diseases that have to do with joint inflammation and other things, right? And lupus and stuff that have strictly diseases that have inflammatory manifestations, right? Inflammation means swelling and distortion of size and those kind of stuff. But I want to ask you, so when I was growing up, I heard about rheumatic fever, didn't you?
Yeah.
So that's a very Grenadian thing. I think we need to say it here because people might not realize it's the same thing we're talking about.
Yeah.
Because that was just the local terminology. It was sad because as I grew and in medical school, you understand what this thing is like. This is not very romantic at all, right? Because it is a very, very serious disease, especially that it should not exist in anybody because it's so easily treated. Just a matter of recognizing that it exists so that you can treat it. Okay? So there's nothing romantic about it. As a matter of fact, the only romantic thing is if you discover a child has strep throat early and treat it properly. That's the sweet part.
Maybe it's because of the association with the heart. That's maybe where the romantic comes from. Let's go back.
It sounds good.
Let's go back to our telephone. Doctor and call, good evening. Hello?
Hi, good night.
Yes, good evening. Go ahead, caller.
All right. So, I was wondering if you have rheumatic fever, so let's say at age 6, right? And you have a slight hot murmur, all right, at the moment at age 30, are you able to live a regular life, or you have a chance of getting a heart failure or something of that sort? That's the first question. Next question is, what other organ is mainly affected by rheumatic fever? Thanks.
Thank you very much, caller. Thanks a lot. Doc?
So, that's a very good point. If you have a murmur and you know it's from rheumatic fever, it means that your valve is already a little affected.
Okay.
It's an extra sound on your heart. You know, if you listen to the heart, if you put your heart against somebody's chest, you hear, look, do, look, do. You remember, all of us can say what the heartbeat sounds like, right? But sometimes you hear, look, do, look, do, or look, do, look, do, look, do, right? Those are murmurs, those additional sounds on your heart. And it has to how the blood flows, because normally it pumps and it closes, so there's no flow back.
Right.
And there's no slowing of the flow, right? If the valves are weak, you might hear some flow back, right? So you hear look, look,
Okay.
Or you might hear when you pump, because it's not properly closed, you still hear the loops.
Yes, that, Or
because it's narrowed, you hear as you try to get it through, right? Like a whistling sound. So a murmur, yes, he says there's a slight murmur. And I guess slight means that we may not have any symptoms related. And a lot of us do have murmurs, that we are born with, we don't all have perfect valves. So you might listen and hear. Sometimes we have murmurs because of the spaces in our hearts that don't close up properly as they should at birth and other things, right? But those are congenital things, okay, things that you're born with. And we need to kind of compare those heart conditions in children with something that's acquired, because rheumatic fever is probably the most, rheumatic heart disease, which is specific, right, where you have all of those heart challenges, is probably the most feared acquired heart disease, okay, and the most common. No. So he talked about that. Yes, and you probably can use you probably can live a normal life if you don't have a slight murmur. Like I say, there are other people who walk around with a murmur and they don't even know, because a lot of people have just discovered just have a murmur by listening to their chest properly. You hear the sound. You get short of breath now? I wouldn't even tell you how old I was when I discovered I had a murmur. By that time, I'd finished medical school, was working, playing netball from a school, played judo when I was in university. I'd had a daughter. I'd lived a life. I'd done crazy things. I know I just couldn't run, but I'm no athlete anyway. Somebody needs to be inspected. Somebody needs to be making noise on the side, okay? But you should be able to live a normal life, and that is what we want. That is why early diagnosis and appropriate treatment, because you may get some damage, but you want to ensure that you diagnose early and you treat, so that this young man who at 30 may have or whoever is the person who knows, have a murmur, can live a normal life. That's what your cardiologist does. The heart specialist will check and make sure how much function your heart has. The methods of doing that, you can do an echocardiogram, you can do an electrocardiogram, because we haven't actually spoken about how you diagnose, okay?
Uh-huh.
But we're going to talk about it after. We're going to talk about this right before we take the next call. But you can do electrocardiogram, you can do a thing, and you can continue. Where else you got to affect? Which other tissue? Like we said, the joints.
Yeah. Mm-hmm.
On your skin and the brain, because you can have seizures. When we talked about it, because that gets inflamed as well, and you can have all those strange behaviors because you get inflammation to the brain. Okay, those are the principal tissue, but those joints, that migratory thing, that debilitates and prevents the movement, your free movement. Those are some of the situations that we have to consider.
Right.
But then, diagnosing,
yes.
Early diagnosis. Always have an index of suspicion when your child between 5 and 15 has a sore throat. And a sore throat that make them sick. Children will get sore throats enough.
Mm-hmm.
But just be aware. Ask the doctor to check, and you can also do a simple swab and send to the lab to make sure there's no strep there. Sometimes the thing speaks for itself. You look at it and you know this is a strep throat because it has this ugly grayish
yes, you
white,
see that. Uh-huh.
lally looking stuff that stick onto the tonsils, and your child can't eat. He's in severe pain. You know, I have to give him some coconut water just to cool him down because he's so thirsty from the fever. But he's ill. So there is that. Finding out early and treating properly. How do you find out? Index of suspicion. You ask the parents what's happening, where do you live, anybody else have this? Has anybody else in your family had strep throat before? Remember, families might, because like I said, you and I would work in the same room. I get it and I don't pass it on to you because your body don't have that kind of propensity to to be affected. But if you are my father and you had strep throat as a child, you can't be my father, but I should really have some level of suspicion. So a mother or auntie or somebody should say, no, we've had strep throat in our family. So if anybody else gets it, we have to look out to make sure that they don't get it. Right? So you have to have index of suspicion. And then, of course, the doctor has to examine you, look at the child, and, fever. What else is there? What is the temperature? Is it over 38, 39? How long is it prolonged? What the lymph nodes look like? Examine the child properly. What the tonsils look like? All of those things. Does he have a cough? Does he have a runny nose or like thick secretions of a bloody secretion? This is what they keep saying.
Okay.
Does he have all that? That's just diagnosing strep, right? And of course, doing a swab. And when you get to rheumatic fever, you think about all the other symptoms. Did this child have 2 weeks ago? Did he have a strep throat? Did he have even a little sore throat, right? Is he vomiting? Does he have abdominal pain? Does he complain that his heart is fluttering? All of those things you ask. And of course, yes, you can do the swab. You may not find anything on the swab, but it is quite likely that when you do a blood test, you'll find antibodies.
Mm-hmm.
The other thing you need to do is a heart test, an electrocardiogram.
Mm-hmm.
An electrocardiogram basically says how the electrical system in the heart works. And then you do an echo, which is an ultrasound that sees how the valves are moving, are they slow, and you can hear when you have a murmur and that kind of stuff. So those are the things you want to do. Child having seizures, you're probably going to have to do a CAT scan or something and see if there's any chance.
Okay, all right, lovely. Let's go back to our telephone. I think we have a caller on the line. Doctor and call, good evening.
Good night.
Yes, good evening. Go ahead, please.
Sorry, not from the doctor. If you are rheumatic, if you could have a hole in your heart.
Caller, we didn't hear you too clear. Could you say that again?
Not from the doctor. If you are rheumatic fever, if you could have a hole in your heart.
Okay, thank you. Mm-hmm.
You're welcome.
Is It's a thing you're born with. You're not born with rheumatic fever, but guess what? You can still get rheumatic fever having been born with a hole in your heart. Do you understand me? Because when you're born, there are the circulation in the mother's tummy as a fetus is different from when you're born. So when the baby, that's why the doctors like when the babies cry, because when they cry, they take a big deep breath, right? And then all these spaces shut up, right? The holes between the ventricles, the auricles or the atria up on the top, those close and those on the bottom close. Not everybody's closes up or closes, right? But that is a thing you're born with. That's a congenital challenge. You can still get rheumatic fever.
Okay. Mm-hmm.
It's not going to cause a hole in your heart per se. It will cause your valves to get weak and not to get tight.
Mm-hmm.
But your hole in your heart is what you're born with. The rheumatic fever
mm-hmm.
and rheumatic heart disease in particular is what you acquire after having had untreated properly or improperly treated strep.
Sure. Mm-hmm. Okay, let's go back to our telephone. Doctor and call, good evening.
Yeah, thanks for my line, but Godfrey, you are a little bit too rough with them, color. You have to take it more easy.
All right, Doc, we were talking a little bit about the how it's diagnosed. I think we covered that quite nicely. And I was asking earlier, I don't recall if we were finished, but we were talking about the rheumatic conditions and whether they are associated with rheumatic fever. We mentioned rheumatism and so on.
All different forms of arthritis,
mm-hmm.
But that affects especially the soft tissue and cause swelling and stuff. Those are rheumatic conditions. But rheumatic fever is different. Rheumatic fever is acquired. The rheumatic fever that we're speaking about is that you have swelling and pain in the soft tissues and the joints, but it's because you have been infected with strep beta hemolytic from the group A.
Lovely. Let's go back to our telephone. Doctor and call, good evening.
Good night, Godfrey.
Yes, good evening. Go ahead, please, caller.
I'm going to ask a question. If the doctor cannot answer, I would rely on you to help her. Yes, with regards to the testing of blood pressure, I am an old person. I noticed for some time now, my systolic might range anything time between 130-something to 103, 105, but my diastolic usually falls way below 80. Sometimes it's in the 70s and sometimes it reaches as far as 67. My heartbeat generally is within the late 60s and middle 70s as a heartbeat. What does the doctor think about that kind of reading?
Tell him no. I don't know how old he is.
Stay with us, doctor. Stay with us.
You want me to tell everybody? All right, 76. You hear? I'm 76. You hear?
Congratulations.
Huh?
The new guidelines, we want you to be under 130 as a systolic and under 80 as a diastolic.
Yeah, but the final is far under 80, sometimes 67, 69, sometimes 73, 75.
Hey, jump on.
Sorry?
But hear me. I'm glad this gentleman called because we've spoken about hypertension before and people get scared when their pressure gets low. The guidelines are stating if you're not diabetic, your blood pressure the top one must not be more than 130 and the bottom one must not be 70 or more than 80.
Okay.
Right?
Okay.
Long as you feel sick, tired, you can't get up and do your housework, you can't go in your little ground and cook and plant.
No. I'm 76. All I have is a pinched nerve and I'm giving some real problems with a bicep muscle on my right leg. However, when
in the community and try and help them to get their blood pressures down to those kind of readings, because if you are diabetic, you need it to be even lower than that. And like I say, if you don't feel sick,
I don't feel sick. And I check my my blood sugar reading almost every morning. Like this morning, it was 97. Okay, fasting. Yesterday, it was 103. I don't like it to reach 100, though. But sometimes in the 90s and maybe the 110 or 15 or, you know?
Very good.
15, okay? But they have never
Thank you very much.
high up at
Remember,
the time.
remember to just get the other guys on track. Whatever you're doing, invite them. Go for a walk, eat less, lose the belly, don't drink, don't smoke.
No, I don't. I eat no dairy. I hardly get into any sugary drinks. I don't smoke. I don't drink. Okay? I try to eat safely. But that pinch nerve.
Yes.
Starting over my right hip there and going down. And below my knee, a bicep muscle on my right. Oh, gracious heaven sometimes. So I'm just trying to treat it and go to see almost every day. You understand?
So guess what? You have to have something to let you know that you're still alive, okay? And that little pain sometimes come in handy.
Yes. Okay then.
Thank you very much, caller. Thanks a lot indeed, yeah. And Doc, well, that was our last call. My good friend is in excellent condition.
I'm impressed.
Very well, yes.
You want to generalize and say that our men are not doing it right, and he's really trying. It's 76 with those kind of readings.
Oh, that's excellent.
That's very good. Living an exemplary life, and I hope our men take a little hint from that.
Right, Doc. Well, we basically at the end of time. Just briefly on rheumatic fever, how it's caused quickly, and just the final little caution to people.
So rheumatic fever is a complication. That's what it is. That leads to other complications, right? But it's a complication that arises from strep throat. We talk about strep throat loosely. Strep throat is caused by the strep throat that we know causes rheumatic fever is strep throat that comes from the beta hemolytic, it's called beta hemolytic strep from the group A. That specific one, okay? Which is easily identifiable, occurs in people 5 to 15 years who live in challenging conditions often, or usually you'd find out a strep in children and young people. And in camp, in the army, that kind of, where people live very closely together for whatever reason, whether it is having fun or whether it is just because, social and economic conditions make them live. We know that people who have family history are more likely to develop rheumatic fever, right? We know that you really should treat it because while it might heal itself, a lot of people will actually develop rheumatic fever if you don't treat a strep. We know that rheumatic fever, the symptoms of strep throat is not like an ordinary sore throat. Your child is very ill. Mm-hmm. And when you look at the tonsils, you see you tell him open his mouth. Let me see. He can hardly open because there's so much pain, right? And he feels sick, right? He has high fever. You see the white plaques, like if you take a condensed milk and you drop it, it's ugly, okay? You're not going to forget it if you see it. But you look and make sure that you see it. And that calls for treatment, right? We also don't want mothers whose children have simple viral infections expecting to get antibiotics because my child is a sore throat. What if he has strep? Guess what? Let's do a swab and send it to the lab because that will confirm. In the interim, the doctor should start medication. I need to take off all your medications. Mm-hmm. Right? If you don't take your medications, you don't get treated, you're likely to develop rheumatic fever. Mm-hmm. which has a lot of pain and especially migratory joint pains, and you're sick, and you can have palpitations and other stuff. If that also isn't treated, you can have complicated illness because if you know when you have rheumatic fever, you have challenges to your heart, you have challenges to your joint, you have these nodules on your skin, and you can have problems with your brain. And Godfrey talked about how he always laugh and think out of turn. This point, but seriously, you remember the worst outcome for rheumatic fever is death.
Yes, indeed.
This is in our young population. The sadness is that we have access to care, It's not always excellent, but things like that can be treated. There's access to antibiotics and all the rest. So we give thanks. And this is a preventable disease. We teach our children to still cover their mouth when they cough and to wash.
General hygiene. Mm-hmm.
And other people have runny nose and all that kind of stuff. Protect yourself. And if, like I said, if you know your family have rheumatic fever and you stay out of the crowd and the crowd diseases, right? And of course, the pediatrician is who's going to manage the child, and the cardiologist is going to have to follow you, and you're going to need to do echocardiograms and electrocardiograms. So electrocardiograms to see the electrification of the heart, because the heart is very like one of the organs that's very severely affected, and we can probably die young. So we want to know that we can prevent. Prevention is the hallmark of rheumatic. I knew that several years ago, but I heard it's increasing. So I'm going to ask parents to, look out and make sure, because we don't want those bad outcomes.
Right, definitely. Doc, I want to thank you so very much again, for always accepting the invitation. It is such a pleasure having you every Tuesday evening, most Tuesday evening, to chat with us. It's really a pleasure, and I want to thank you very much. We did get a request to deal with head injuries next week. So the man
of us next week, so don't put words in a man's mouth.
Well, he said tonight, but we couldn't do it tonight.
And I understand traumatic brain injuries is an up and coming point of discussion, because you've seen a lot of those football players who have their head injury. I've seen sometimes you see people have accidents and have a lot of behavior change, right? That's from TBI, right? Which is a topical thing.
Yeah.
And information we have about our population, which is also something, we have more accidents because we have more cars and we have more people drunk driving and all the rest of it. But let's see, maybe not next week, maybe soon.
Sure, not a problem. Definitely.
As usual, I want to remind everybody that COVID is very alive. You guys can play as much jab as you want. Take care of yourselves, people, right? Nobody likes jab more than me, I tell you guys. But I couldn't do without. I believe that if I don't play jab this year, I can play it twice next year.
Oh, definitely. You can play Monday and Tuesday. Mm-hmm.
We'll have a lot of 21 if we all stay inside and follow the directions from the Ministry of Health. Still maintain social, physical distancing. Love people still. Still do the hygiene thing. Wash your hands. Cough into your sleeves. Wear your mask.
Indeed. Sanitize, yes. And
we're not wearing masks because we're not in the same room tonight, I remind you. But please do that. I see too many people walking the streets in St. George's and other places.
Oh, yes.
Whatever they don't come into my office without a mask. But please, love yourself. And love yourself a lot. And give a little bit for your neighbor.
Yes, indeed. Thank you, Doc. All the best, and do have a good night.
Yes, good night, everybody.
All right, all the best. Good night, folks. We thank you very much. Join us next Tuesday at the same time for another Doctor on Call.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Drug abuse, cancer,
measles, diabetes, AIDS, cancer,